let's begin our discussion for today on bipolar disorder with mixed features. So, first, let's start with diagnosing mixed feature specifier. So, we know DSM-5 has moved from mixed episode to mixed feature specifier. And this specifier applies to current manic, hypomanic, or depressive episodes in either bipolar 1 or bipolar 2 disorder. So, very briefly, what I will do is I will try to summarize these specifier diagnoses in a good presentation form so that it's visual and you can easily apply this in your clinical practice. So, let's say a patient presents with manic or hypomanic episodes. And that is associated with at least 3 or more of these symptoms, which is depressed mood or prominent dysphoria, diminished interest or pleasure in doing things, psychomotor retardation, loss of energy, worthlessness or excessive guilt, or recurrent suicidal ideations. So, if this combination is present, then a patient will get a diagnosis of bipolar 1 or 2, manic or hypomanic episode with mixed features. So, very clear cut. So, it should be 3 or more of these symptoms with manic or hypomanic episodes. Now, if a patient is presenting with depressive episode with 3 or more of these symptoms, which is elevated expansive mood, grandiosity or inflated self-esteem, increased talkativeness or pressured speech, flight of ideas or subjective racing thoughts, increased energy or goal-directed activity, decreased need for sleep, or increased involvement in risky activities. So it should be 3 or more of these 7 symptoms with depressive episode. Then you will give a patient diagnosis of bipolar 1 or 2 depressive episode with mixed features. Now you must have noticed one thing here. In these 7 symptoms, we don't have the irritability, psychomotor agitation, or distractibility. Now, the interesting thing is that these 3 are excluded in this for diagnosis making in DSM-5 mixed feature criteria because they have mentioned that there is an extensive overlap of these symptoms with other disorders like anxiety disorders and between mania and depression. So, this is a very important topic for debate whether to include them or not include them. But when you look at studies on these symptoms, the studies have shown that presence of psychomotor agitation and distractibility in mixed episodes is associated with poor treatment outcome. So be mindful of these when we exclude them. Always look for these symptoms, but they are not used in DSM-5 for the diagnosis or with these specifiers here. So, moving back to the table that we were talking about, so we know how to diagnose with the manic or hypomanic with mixed features, depressive episode with mixed features, but what if a patient is presenting with a manic episode with also meeting full criteria for depressive episode? What will the diagnosis be then? Well, according to DSM-5, then you will diagnose your patient with bipolar 1 manic episode with mixed features. So, this was a very brief overview of how DSM 5 diagnoses now as a specifier. But very briefly, I think the talk won't be complete if I don't touch on DSM 4. So, there was a big difference. DSM 4 gives a diagnosis of mixed episode, and DSM 5 have a specifier, mixed manic or mixed depressive specifier now. Well, going for DSM 4, we know for a mixed episode, a patient should have both manic episode and a major depressive episode criteria for nearly every day during at least that 1 week period. And in DSM 5 specifier, for a mixed manic or hypomanic, I should call, manic symptoms should be present for 1 week or hypomanic for 4 days, and for depressive episode, it should be for 2 weeks. Now, I think the next question is, what is the difference? Well, you go by mixed episode of DSM 4 or these DSM 5 specifier. What is the difference we have seen? Well, studies have shown that there is 3 times greater risk for a diagnosis of mixed feature in patient with bipolar disorder when you use the DSM-5 criteria compared to the DSM-4 criteria. Well, is that a good thing or a bad thing? I will let you all decide.
So, friends, this was a very brief overview on diagnosing mixed feature specifier of bipolar disorder with mixed features. This was actually a part one of this discussion. And in these full discussion series, I have also talked about why is this diagnosis important and what assessment scales to use. And the last section is actually 1 hour 20 minutes long, where I have compared 20 treatment options for mixed features. And here I have compared the 2018 WFSBP guidelines with 2021 CANMET and ISBD guidelines on this topic. So, if you're interested in learning more, please consider subscribing to Psychiatry Education Forum Academy membership. Go to psychiatryeducationforum.com to learn more. But I will see you in our next clinically relevant discussion. Till then, you all take care and bye for now.